Assalamu alaikum, everyone. First of all, I'm very thankful to Youth Diplomacy Forum for providing me an opportunity to discuss about the impacts of the COVID-19 on clinical and mental and psychological health in the people of Pakistan. Being a humble student of health sciences, I would like to discuss some points because the time is very short. So I have comprises the list of 10 parameters which I will discuss in few minutes up to you. Let's start. The novel coronavirus pandemic has not only emerged as a major health threat throughout the world, but it has also brought many social, financial, and psychological challenges with it. The financial and the economical sector has been discussed by the Nizam Khan. Now we go to the further. So this large-scale pandemic has adversely impacted the lives of a significantly large population of the world, particularly the underdeveloped countries like I am living in Pakistan, which is an underdeveloped country. So Pakistan reported its first case of the coronavirus in February 2020 and government implemented a nationwide lockdown in the third or second week of the March 2020 to contain the situation by flattening the curve of the spread of the disease. So in compliance to the lockdown measures, all the education institutes, all the significant public places, including the shopping malls, religious worship places, restaurants, and many industries were closed. So the lockdown led to the many problems that were likely to increase the psychological burden of the population or the people living even in the developed countries and specifically in the underdeveloped countries like Pakistan. So I will discuss few points. First of all, we start from the social life of the people of Pakistan. Pakistani society significantly values socialization and social activities, and the people give a lot of importance to the social interaction. This implementation of the lockdown and social distances created a disruption in the routine activities of the people. So consequently, which increases the emotional pressure of the people. So the people were very much emotional about the situation which was created due to lockdown during this pandemic. So the second point is stress and fear. Since the emergence of COVID-19, many conspiracy theories and myths about the conditions have been spreading in Pakistan, which also resulted in developing fears and the anxiety. Moreover, these lead to more uncertainty and increased unrest among the public. All these factors stress the need to express the or to explore the psychological influences of the coronavirus pandemic in the general population. So the people were getting stressed and feared about the situation. Can you please move the slide? So my third point is financial pressures. As we know that Pakistan is a underdeveloped countries, and the financial constraints and the pressures also contributed to the psychological difficulties because of the large population of the Pakistani people works in a private sector or belongs to a daily wage force with 24% of the total population which is living below the poverty line, and 38% of the population reported to be poor. As a result of the complete lockdown, the country has faced a serious halt to economic activities, and many workers have lost their jobs and faced significant cut in their salaries, which contributed more to already existing financial difficulties, which increases the anxiety and depression, and which resulted in the increase in the cases of suicide during this pandemic period. So the next point, please move to the next slide. Next point is anxiety and depression. A study conducted showed that the impact of the coronavirus in Pakistani university students, and observed that 34% of their sample had moderate to severe level of anxiety and 45% had a moderate to severe level of depression. Let me please clear about the difference between the anxiety and depression. Anxiety is when you are anxious or when you are feared about about your future. And depression is the state when you are fear or anxious about what was done in the past. So due to this pandemic, these two problems, psychological problems, were faced by the people of the Pakistan. These are the situation is very alarming because due to these two problems, fear and anxiety and depression, people are at the higher risk of developing cardiac diseases like hypertension and ischemic disease and obesity, etc. Please, next slide. And lifestyle changes due to lockdown imposed by the government in response to COVID-19 infection. The sleeping patterns of the people, especially students, were disturbed, and the too much use of the social media gadgets disturbed their sleep patterns and their regular behavior patterns. So this was also very much problematic for the students and their educational activities, which was badly affected due to this lockdown and the pandemic period. Next point, please move. Yes, point number 6. Okay, children and teenagers. Many children, young people living are having experienced loneliness during the lockdown. Many were in the hostels, and many were far away from their parents. So it also distressed them and created stress upon the minds of the children, and it was very much problematic for the students in this their young life. So please, next, treatment discontinuation. In March 2020, a report shows that in March 2020, fewer patients visited the service for the psychiatric interview, which was very much reduced due to the lockdown. This reduction seen in the follow-up compliance increases the risk of treatment discontinuation, and there were more chances of the possible relapse or again being deceased, or the psychological problem may come again due to the treatment discontinuation. Please move to the next point, marital life and the social life. The ongoing pandemic has brought changes in the social and the family behaviors. Lockdowns of virtually every type of gathering places, like staying at home, years instituted to combat the spread of the virus, have forced many families and couples to live in much closer and continual contact than the normally experience. It has affected the relationships among couples in a negative way because of the lack of the full-time day-to-day interaction. It has also been observed that the rate of conflict was increasing. There was an increase in the divorce ratio among the married couples in Pakistan. So my next point is population density. The famous newspaper of the Pakistan, the Dan, reported that estimated 29 million babies will be born in South Asia in 9 months after the COVID outbreak was classified as a pandemic by the World Health Organization, while 5 million births will be reported in Pakistan, according to the report released by the United Nations Children's Fund. So when there will be overpopulation, there will be lack of resources and there shortage of jobs. So this will cause the psychological problems for the people of Pakistan. So my last point is the religious activities. As we are well aware that Islam is the state religion of the Pakistan, and the 98% of the people are Pakistan, and religion is the source of comfort and for guidance for the people. So during the lockdown pandemic period, religious activities, including the prayers in the masajid and Umrah were halted, so which remain the cause of distress and comfort for the most of the people as these times, having negative effects on the mental health of the population, because religion is the source of catharsis for the people. So when these activities were halted, so this creates psychological distress and stress for the people. So these were a few points which I discussed. Hope you have learned something. If you have any question, you can email me, and you can get my email from the host. Thank you very much. Musafar Bhai, I'm